right.
You gained last night.
Lucky, lucky, lucky.
So, Lisa, where's yours?
Blew it.
Can you make yours huge?
They should get rid of
It is on mine, it's full screen.
coach.
There you go.
I don't know what he's thinking.
Was,
Did I leave that there?
the guy had no gas on
The
the,
what?
on the
I'm
mount.
just gonna leave that there.
He's out of
Oh,
gas.
okay, sure.
So you're good.
With
And
the
you're
rest of
live? Okay, we are live.
I don't know. I don't know what the answer is, so I don't.
Okay, I guess we're ready to go. We're just waiting on, I think, Ryan, but we'll start anyway. We have a quorum. If we could call the meeting to order and I could get a motion for the approval of the June 14 minutes.
Nightingale move.
Okay, great. All in favor?
Aye.
All right, no one opposed then, thank you. Brenda, I see her on, she doesn't have any resolutions tonight, we do have 10 on the agenda, but none from Brenda, but she does have a couple things on her update. And if we have any questions for her, if there's anything she'd like to add, go ahead, Brenda, feel free.
Yeah, the only thing I'll add is just that the farmers market coupon distributions are coming to a neighborhood near you. We're starting tomorrow and going all throughout the county. If anybody needs any information about where we'll be and when we'll be there, it is on our website, or I can send you a copy of one of the flyers. And I ask you to think of our staff. If it's while we're out there, the way this weather has been lately, I'm afraid we're going to be getting very wet, but we'll see. We'll see how it goes. So, does anybody have any questions for me?
Does anyone have any questions for Brenda?
Yes, I have one.
Okay, Mr. Lattimore does.
Brenda, during this whole shutdown and pandemic, the SCAT vans, are you in charge of SCAT van?
It is its own entity run by Sue Van Epps, but I might be able to answer a question.
I'm just wondering, how are they doing? I mean, very helpful to the county with regards to getting everybody around.
They have continued to provide service almost continuously throughout all of this. And, I think they're holding their own. But Sue Van Epps, I could certainly check in with her and see if she has an update for us. We support that SCAT van, but they do operate independently out of the Willard Chapel, and they have their own board and all that. Mm-hmm.
I think one time we gave them some extra gas money because gas prices were high.
Yeah.
You want to check and see whether?
Sure, I'm happy to check with them. Sure.
Yeah.
I know they've continued to be very helpful. I know they've brought people to vaccine clinics, and so they're just always really wonderful about doing whatever needs to be done for the seniors to get them where they need to go.
I'm just wondering whether or not we can maybe do more for them because of the COVID. I don't know whether they're eligible for.
That's a good thought. I like that thought. So perhaps we can talk to Sue some more about that. Yeah.
Place one of the units because of all the extra miles or something. I don't know. Anyways,
Heidi?
I do have a couple of friends who are involved as volunteers with the SCAT van, and they noted to me when I asked them questions that actually their volunteer rate went up. So, it's an example of when things are at their worst, people are at their best.
Yeah, right.
sometimes.
For sure.
I don't know if this is for you or Kathleen, or if this is even relevant anymore, but at one point there was a full court press to try to get to identify the essentially homebound in this community so that immunizations or vaccines could be offered to those that were unable to get out. Is that still on or not so much?
Yeah, no, Kathleen and I and Nancy Purdy have actually talked about that. We've had some conversations with some potential providers, and I think we both feel, and I'm sure we can get a little bit more information from about that, but it is we seem to be meeting the need. So the folks that we have been able to identify, that Department of Health has identified, Kathleen and Nancy and the staff have seemed to have been able to really meet the need of those who are seeking those homebound vaccines. So not to say there aren't still some out there that maybe we haven't found yet, or don't know where to call. I mean, there's still potential, but we're, I guess, pleasantly surprised. We seem to be making really good inroads there.
What surfaces you're able to meet the need of. Yep, great. Okay, thank you. Anything else for Brenda? All right,
Thank you, Brenda.
thank you, Brenda. You have a good night.
Thank you.
Okay, Kathleen, if you you can at your pleasure, do the 3 resolutions first or give your
Better if
report.
I kind of centralize myself a
Yes,
little?
that would be great.
Okay, do you want to do resolutions
Yeah,
first?
that would be great.
Great. So we do have 3 resolutions. The first is a request for us to accept some grant funding from the state. It's to work with school districts and schools, the public schools and the private schools in testing and related to COVID prevention in classrooms. We do not have a work plan in place yet. We are looking to accept the funding. We'll develop work plans in conjunction with our school partners. So this is a formalization to accept that funding.
Can I get a motion for HH1?
Nightingale, move.
Second? Mike? Okay, thank you.
And so the next 2 resolutions, we have our position requests to fill. And I did ask Lori Fisher, who's our director for our Children's Special Health Care Needs Program. And then the next position, I asked Eileen O'Connor, who's our environmental health director, to be here if you have questions that I'm not able to respond to. But some of you may know, last year we had a service coordinator, did our initial service intake, went on medical leave. She later chose to retire during that time period. We were able to get a temporary fill. We are looking now with her retirement to fill this on a permanent basis with some overlapping time for the incumbent to help train, not only train and orient a new hire, but the caseloads are such that we would have to do something with the caseloads. So she needs to try and wind those up as well while orienting the new person. I'm kind of doing, I'm giving you the short data point, but if we have particular questions, we can certainly speak more to that. Lori has some numbers in her head if you're interested.
Why don't you just go all through all 3, and then I'll
Glad to.
ask for a motion for all 3, and then we can have discussion.
Beautiful. And then the final one is a request for a principal typist vacancy that we've had vacant since 2020 when the person who was in the position moved to a new job. This is in our environmental health division primarily that works, but really we found, particularly with COVID, that we've overlapped. All of our support people work all over, but as Eileen will attest to, we miss having a consistent person in that role, particularly now that it's summertime and we're back into a lot of the programs that are that much busier this time of year. So we are looking, it is in our budget, but we're looking to fill this position now, and we anticipate there'll be a new list coming out within the very near future because the test for this position was at the beginning of the year.
So can I get a motion? We did one for one, but we'll just do HH 1, 2, 3, motion for all 3 of them.
I'll make a motion from 1 through 3.
And then-
I'll second the motion.
Okay, and then now if there's any questions about any of those resolutions before we vote?
I was wondering if you could speak a little bit to the early intervention and what you're seeing with some of the cases. Have you seen any effects of COVID from last year and on demand for those services and things like that?
If you'd like, if you're okay with Lori speaking to her, I'm gonna get the graph that Lori had put together also.
Oh,
So
yeah.
with that, I have it in my folder. I'm not gonna show it.
Yeah, so, because of COVID, children weren't going to their doctors, so there was a big pause with, well child checks. So right about March of 2021, families started going back to their doctors and doctors are now referring. So there really has been quite an uptick in our referrals. March, April, May, June, we were almost in the 30s every month with referrals. And so what's happening with that is we have timelines that we're required to meet through the regulations from the Bureau of Early Intervention. So I have an initial service coordinator who's now in that medical field, but we really do need to have a permanent position because the referrals are not stopping. They're coming in droves, and we can't just not we have to pick up these referrals when I get them. I have, timelines with which we have to meet, when we get the new referrals into the program. And that initial service coordinator is integral for making sure those timelines are being met. And unfortunately, right now, with the volume of children we're getting, we're not meeting some of our timelines, which really is gonna be towards some of our annual performance reporting measures. Every year, we always meet requirements for that, but my fear is because of COVID and now with the wicked uptick of referrals coming in from children that have not seen their pediatrician in over a year, it certainly has a snowball effect. So it's making a huge difference right now.
How many of the referrals typically would then come into program? Or on average?
So I started to crunch some numbers. I would have to say at least 85% of the referrals that come to us will qualify for services. We have some families that will choose not to want to participate in our program, even though the doctor may refer. It's still a family's right and choice to say they don't want to do it right now. So we do have some refusals, and then we do have a small percentage of children that do not qualify for EI, but for the most part, I think I can go back as far as April because May and June are still really in the works. I had 28 kids referred in April. I believe 5 children did not meet the eligibility and 3 families refused. So all of the rest of those kids of the 28 moved into services. So once they become eligible, they are now in the program with an ongoing service coordinator assigned to watch them. So out of the 28, we're at 19 now have come into our program. So now 19 children now have assigned the service coordinator. I have 3, and they're pretty much they're peaking their caseloads. So our caseloads right now are in the high 40s, low 50s.
This hire will get you back to 4 service coordinators.
Yes,
Yes.
so the hire will bring me back up to 4.
Okay.
One of them is brand new right now.
And one is brand new. We just hired one, so she's still learning. So I mean, there is a learning cliff in our program. It's not a curve. I mean, there's a lot to learn, a lot of layers.
I had asked Kathleen about HH2 and if it talks about allow for the overlap between the newly hired position and the current temporary fill, what the reasonable expectation for that was, and he told me it was 180 hours or
That would be ideal
a
to
little
have.
over 4 weeks, which seems reasonable. So, I mean, I don't know if this will be asked to be amended at ways, but we could include that language if you'd like, with the overlap for a period of up to 180 hours.
It just for the sheer reason that we have to keep processing these kids. We can't say, oh, we're stopping for a month while we train. So
I think that clarity of the overlap
Yes.
helps the full legislature.
Could we have that amendment?
I believe you need to make a motion
Okay,
to make that amendment.
All right, we will do when we vote on that. And then the only other thing while we're talking is, I had talked to Kathleen, this is $2 million of money coming in. That's a lot of funds and, contingent on your work plan, contingent on the request from the school, whether we spend all this money or not. It's another challenge you have from the state trying to figure out how to put all this in play by September. But
A little bit of a hot potato.
Yes.
Not every
the option would be
County
to say, no, we're
money.
not taking the funds, which didn't seem to be an appropriate option to begin with, so. Yeah, but yeah, another challenge of, workload that comes to the local health department to try to coordinate. So that is a lot of money.
Madam Chair?
Yeah.
I'm a little confused. Is this behavioral problems or is this?
Developmental.
So this is birth to 3, children that show developmental delays. Either they have a diagnosed condition of autism, Down syndrome, cerebral palsy, or they're made eligible through a multidisciplinary evaluation. That's done through standardized testing.
And opioid addiction?
Very possibly could be, yes. So we do get children that are have the diagnosis of NAS, which is neonatal abstinence syndrome, that have been born addicted. Yes.
It's easy for you to say that.
Neonatal abstinence syndrome,
Oh.
NAS.
Okay. So, with this pandemic, didn't Congressman Cayuga get additional money, like, what's the 2 million? Is it designated for any of these?
This particular grant is not designated for opioid use. It is COVID and testing and school-based related.
And it's just, this is a state program that where children qualify and get,
Because they were shut off, now that they couldn't see the pediatrician, so.
more
We're trying to
referrals
catch
are
up.
coming.
So yeah, as far as the early intervention is a state mandated program. It just absolutely, we're getting a surge of referrals right now. Absolutely, that's part of, because people were not engaged in healthcare as they might have been.
Does our population have telecommunication skills to see their doctors?
Yeah, well,
They
certainly
do.
that has happened, but it's hard to, you need to assess a lot of time your developmental delay, particularly for a
Yeah.
child in person. And to see where their skill levels
Do
are
we
at.
have enough professionals out there to diagnose them?
We do not have enough therapists right now. And Lori, do you want to speak to that at all as far as wait lists or therapy referrals?
Sure, so yeah, for early intervention, this is the first, I think within this last year and a half, we've had to move to a wait list for children that are waiting. What we're missing are speech language pathologists, occupational therapists, and special education teachers. So we have a grave shortage, which actually affects the 3 to 5 population even more. We have 25 children this school year alone on a wait list for a special education teacher. So they didn't get the services that was identified on their individualized education plan.
So these would be kids that don't go to a state education approved program, but actually would be in a natural environment and hopefully a special ed teacher would come and they're not available to come.
Is our community college trying to produce those teachers, or?
Well, we certainly, work with, and the college has a good early childhood program, but some of these therapy programs, they require, further education, some of them doctorates. The physical therapists are now doctorate programs. So it's a challenge. There are some schools, and we know that your associations often work with the schools to try and encourage that. But it's a challenge, and in rural areas, it can become more challenging, more so often than in urban area.
Teletherapy was an option this year because of COVID, but it just didn't work for some families.
Yeah. Thank you.
Okay, so if we could, we'll do the HH2 amendment, all in favor of HH1?
Aye.
Aye.
Opposed? HH2, I'd like to, I guess, propose an amendment to HH2 to include that the crossover or the overlap be for a period of up to 180 hours. Can I get a motion for that amendment?
I'll make a motion.
Second? Okay, all in favor?
Aye.
Okay, now we have to vote on the resolution, I assume? Okay.
Yes.
Can we get a vote for HH2?
As amended.
Okay, all in favor?
Aye.
Great. And then HH3, to fill the principal typist position in the health department. Motion, or a vote, all in favor?
Aye.
I'm sorry, who seconded that?
Mike seconded? Yep. All right.
Just a few other updates. So it was great that Brenda was on. This is so kind that you brought that up, because literally earlier today, we were just talking more about some of the homebound vaccinations. And there seems to be a system, if we find that changes, then I guess we'll have to look at other options, but we appear to be addressing the needs of our homebound population. And we're still working to see where else can we outreach to. Our COVID, our vaccination rates are really pretty darn good. And I'll try to copy off a demographic age breakdown. Our 65, really our 45 and up are high percentages within our community. It's the under age 40 that is not. And we're trying to be creative also as far as our outreach. So the volunteer firehouses have been very cooperative. We've gone to Victory Firehouse, we've gone to Scipio Firehouse, we're going to Montezuma Firehouse, and a lot of other sites like Malone Village is hosting us again, Brogan Manor, we're setting something up. And a few other sites that we've been going to. And it's smaller groups, but it's, they say, keep chipping away. So for example, last week at Victory Firehouse, it was 36 people. Like, great. I'm pleasantly impressed at seeing those numbers in some of the areas that were shown as per zip code data to not have high inroads. So I'm really pleased with how the vaccination's rolling out. So, and I think you'll be interested. I will try to get that demographic data share with all of you. Education and prevention, that's been a real focus last week and this week. We've had some outbreaks in daycare centers. We know that children's camps are back together. And so it's that reminder that if you have symptoms, don't go to work, don't go to school, don't go to daycare, don't go to camp. And we know what a hardship that is for parents because in order to be at work, you have to have good childcare. But it's not just COVID that's in childcare settings. We've seen RSV uptick in some settings. So it's hard. That runny nose, it's not, you can't just write it off. You really have to identify what's causing it. And another big pat on the back to our accounting staff. So far, through the administrative fees we can charge for our COVID administration, we've made over $70,000 we've brought in to the county. So we're really happy about that.
What is the rate that you are able to make the bill for?
Initially, it was $20, but now it's as high as $40. And sometimes some.
For supplies and the
some-
administration.
Exactly. Sometimes you get lesser for the first and more for the second. So it behooves us to say, come on, get your second, for all the right reasons, but it's better reimbursement when people come back for their second shot also. Children's camps are in session, they're up and running, doing a good job. Harmful algal bloom, some of you might have seen, we have some beaches that are closed. We won't be sending out press on that all the time, but because it is the beginning of the season, it's really a good reminder that they're out there, people, be on the lookout, don't swim in it, don't drink it. Keep your pets away from it.
I missed that release. Which ones are?
Just came out this afternoon
Oh,
in
okay.
Wells College Beach, Casper Gregory. And there's one other one that I'm not recalling. But there were 3 that we put into the
Okay. Thanks.
hydrilla treatment also in Cayuga Lake, as you may remember, the invasive plant species hydrilla. The Army Corps of Engineers, based on Buffalo, is going to be treating the hydrilla in Cayuga Lake again this year. So there's information that's available on our website about that as well. Which is just important for people, particularly attractive notes to the people around if they have intakes, water intakes from there. We spoke to children with special health care needs, and our WIC office is, in motion. The new office setting on North Street is underway. I wasn't able to check out the space, but a couple of our staff members did. And they can just see it coming together. It's very exciting for play space as well as for WIC. The second week in August, some of the walls should move over from our current office space. And then hopefully by the end of August, we'll all be in there and settled up, and as will play space is the plan. So it'd be great. It'll be, we'll have a ribbon cutting of some sort to show people. It's exciting.
Is there any other agencies co-located in there?
The childcare, or I call it the childcare council. I think they have a better, more.
Oh, right.
It's a broader.
Yeah.
Because it's several counties.
Exactly.
Or
Childcare solution.
Childcare solutions, that's it. And I know there's discussion for some other early childhood programs, but at one point, they were pending what their funding was going to be, so it's still in the talking stages. But
Gotcha.
there is room for another early childhood. They're very, want to really think about who co-locates, right? With this, with this area. It's really great. That's all.
Question.
Yes.
This kind of left, I just, so you want to talk about the HABs or HAB season?
It is. So HABs are out there, don't swim in it, don't drink it. You can still report, don't let your pets drink it. Rinse off with cool water if you've been, if you're out water skiing or whatever you're doing out in the lake, jumping off a boat. You don't want to fish in hats either. There is a DEC link, and you'll see that in the press release that we sent out, that you can report blooms like has been for the last few years, which is, that's a really nice thing. Back when this first started, that was we fielded a lot of calls that way. It's really ideal that this is, centralized at the state level right now, but all of our lakes, are affected by this, so we really have to stay aware.
I mean, the governor had the water hub. Have they come up with some kind of plan for
Well,
trying to reverse what's going on?
I know that there's been discussions. I will say the one that I'm probably best versed in is the Owasco Lake watershed rules and regulations that have been proposed for revision that are at the state level right now, and that would help with Owasco Lake. But there's certainly the hub had been very actively involved in that. Like with all things, some people got reassigned during COVID, so I expect we'll be seeing a lot more action and activity in the coming weeks as a
Well,
result of that.
I know that the treatment that we're putting in Cayuga Lake for the hydrilla.
Right.
There's no other treatment for, I mean,
Perhaps.
I had my grandkids were up from Atlanta, and I happened to be in the lake for the first time in a long time. I mean, the flora growing up as a kid was never there. I mean, what's grown in the water is different.
It's scary.
It's
You can't
been-
swim in that, right? You can't swim in a tangle of weeds, so it's tough.
They were saying at the, I don't know, State of the Lake or the TMDL for Cuba, that all the mitigation measures that we can put into place, this is going to be years for recovery. And there's no one quick fix to try to reduce the phosphorus loading and the nutrient loading. It's a work in progress, right? I mean, unfortunately.
It is, yeah, and we all have to do our part.
Thanks.
All right, thank
Thank
you. Christine's gonna do the SS resolutions, but before you start, we had a very spirited conversation at Government Ops about the potential of a local law coming next month to look at the unmerging of the administration of DSS and mental health with a public hearing to be held in September. It sort of did get kicked back through this committee, so that is the place where this will happen. So Rich will just, you want to just give a little quick update just so that people are prepared for next month, because all things considered, working through this with Ray, there is likely going to be this proposed local law coming forward next month that will talk about a public hearing in September, correct?
Yes. We're working on a draft. We have a working document as it is now to separate the management and administration of DSS and mental health. It's currently under a single position, that being the Director of Community Services. That was by reason of a local law number 5 of 2014. So the plan is to repeal that local law and substitute it with a new job description for Commissioner DSS and a Director of Community Services. The difference between this version of the DCS is that the responsibilities would be limited to overseeing mental health. One of the unique aspects of mental health is that in the mental hygiene law, the Director of Community Services is essentially the executive officer of the Community Services Board and is in fact appointed by the Community Services Board. But it's somewhat of a dual position in the sense that that position would also be the department head for the mental health department. We're all county employees. So the local law will, draw those distinctions and draw the two responsibilities into one position. We have draft job descriptions for the commissioner and the DCS that we expect will go through civil service probably in August, maybe September. And these are all set up to take effect on October 1, with the idea that you know, between now and then, as the wedge determines, they will begin recruiting and interviewing for these two positions. Ultimately, the idea is that Ray has indicated his intent to retire sometime in January of next year, and between October 1 and January of next year, he would leave his position at DSS and hold on to the position as DCS as an interim, with the idea that a new DCS will come on board in coordination with the time of his retirement. So it's all a a coordinated plan, if you will. And we just want to give legislators enough time to think about the concept and the idea of the local law will be introduced in the August cycle. It will come through HHS. It will, as you all know, we then set the public hearing for the next legislative cycle, which would be in September, and that's when we would have the public hearing and have the local law up for adoption. And that's kind of where we are.
As I've asked before, I mean, Cedillo and I were on the board when we decided that we didn't want to be in the nursing home business. And we looked at the numbers and we felt that was a wise decision, and I think it's proven out to be an effective way of handling things. The hospital, I think, has indicated some interest in mental health. And just wondering if we could, separate these things. I mean, should we look at whether we want to continue in the mental health business or whether or not we want to have a partner? I mean, I like private-public partnerships. I liked it in the ambulance service, which now is being decided in the city, and I think for public health, I don't know whether that's the right way to go, but I'd like to see whether or not we have a partner out there who could help us with the mental health aspect of it. And who's ever employed there, I hope will continue if we decide, like we did with the
Home care agency.
with the home care, that everybody was employed, everybody stayed. So can we not explore that?
Honorable Vandermoor, I was part of the committee that worked with the initiation of this
Transition of.
transition and, the upcoming potential for the special law changing where we currently are operating. One of the things that came up indeed was a question about should we maintain a mental health center? And I adamantly agreed and stood on the ground that we should. And interestingly enough, if you read Ray Bazari's first bullet about what the mental health center has done just in the last 10 years, not only to assist people, which is the most important thing, but to be literally a moneymaker for this county. And what I hear from you all the time, and many of your Republican partners, is what is this costing my citizens? What am I going to tell my constituency? What am I? So we have private partners. In this very set of resolutions, we are asking to connect with Cayuga County Action Agency. We are asking to connect with the Center for, help me,
Cayuga Centers?
Cayuga Centers. In one of our last meetings, we had a resolution in which we discussed how we were going to, we've had discussions online as legislators about how we were going to support the department in getting a letter of support to Cayuga Counseling Services. This legislature has had a long history of supporting our not-for-profits and having a collaboration between private and public. The Cayuga County Mental Health Center, if you haven't done your research, is one of the most well-noted in the state and one that upon which others are modeled. To dismantle it now under the assumption that, hey, maybe we should get out of that business. It's not helping us. Read this, read what he has to say about the last 10 years as he reflects on his tenure with, and I think it is in a reflective, informative, but a reflective tenure statement on what has occurred just in that particular bullet at our mental health center. I live 2 blocks from the mental health center. I spent every day of my life, the last 30 years, watching people inside and outside that building being served, walking the sidewalks. I get to see it visually. I would absolutely like to shut down this conversation about, let's look at pulling our mental health center and privatizing it. We've got private partners and not-for-profit partners that we work with.
I've worked in a program for 30 years, along with some other people that help those people recover. So I'm pretty close to that population too. I'm just looking at the best delivery system that we could have.
We
Now,
have the best
sometimes
delivery
government,
system in the
wait
state.
a minute, sometimes government thinks they can deliver better. But I mean, you've also got to look at the health and welfare of our hospital. If you don't have a great hospital, if you don't have great schools, if you don't have the infrastructure in place, you'll never get economic development.
Timothy, Honorable Madam Moore, if you can get that information to the legislature, I'll be more than happy to consider it. Get it to us the way Ray got it to us.
So you're close to the.
I am absolutely close to the idea of
There's only
closing
one way to-
our mental health center.
There's only one way to deliver that service.
We deliver it in multiple ways in this county. I just said to you, through the DCS and through the DSS, we contract as we have today in our resolution, in our resolutions, our packet, with not-for-profit partners like Cayuga Counseling Services, Cayuga Centers, consistently and always have. And I've only been on the legislature for a year and a half, and most of it's been COVID focused, but I haven't missed that piece.
Yeah, well, I mean, I do believe in our leader, Mr. Ray Rosari. I think he's done a good job, and as you say, right now it's profitable. Our
See.
Wait a minute, our nursing home is, our nursing home, wait, can I speak, can I finish our nursing home was very profitable. We were making $1 million. And then all of a sudden we got $60 million worth of money from the feds and the state on the tobacco money. We went from a profit of $1 million to losing $1 million that quickly because the rates changed because of the state and the feds. So you got to be very careful as to what you say is profitable today. And all of a sudden we get 22 million in COVID money. All of a sudden our ratios change, and all of a sudden we're not getting reimbursed at the rate that Ray's getting reimbursed at. So keep an open mind.
I will keep an open mind. You show me that those rates change, and you show me over a period of time, so I know it's a pattern and not an incident, and we'll talk open.
And honestly, I know what you are talking about, an optional service the county doesn't have to run. We did have conversations over a year ago about the risks that a value-based payment may pose to that operation, because we're getting a decent rate for the mental health services we provide. That value-based payment system did not impact the delivery of services we were worried about. So I think to Heidi's point, it's got a big footprint here. Currently, it appears that we're covering our operating costs through our third-party reimbursements. And, if there was any conversation about, yes, should we always look at, should we stay in the business for all service? I think it takes an honest and fair look. But, I think at this point, he's trying to make the case that they have enhanced the delivery system with the current number of staff while they're continuing to cover their operating costs. And, at this point, I don't know, we did debate in this small group about, should we be looking at, doing business a different way? And at this point in time, I don't believe that's the case.
Right, I think the consensus of the subcommittee.
Right.
And
But
the
is it off the
subcommittee
table
could have
to look
been-
at?
It
No.
was, Elaine asked for volunteers for months and months to sit on the subcommittee. The subcommittee did take a close look at and had many conversations about it.
I'm in favor of taking care of people who need help. I've never not had a hand to pull somebody up from where they are.
Yeah.
But I'm just saying, our delivery system with government sometimes isn't as
Yeah.
efficient as others
And it's more costly at times too, absolutely.
and not effective.
I guess I just want to add my 2 cents that this is a very interesting exchange. I agree that we have a really strong clinic right now and we have really good partnerships in place. And I also agree that things can change over time. So it's always good to keep, an eye on things and see where things are headed. And then respond. But I guess the only other point I wanted to make was just, and I know that Ray's team is working on this, but beyond the profitability, it's just the delivery of the services right now that we can't have too many collaborations or partnerships or conversations going on right now because we're in a mental health situation with this county. And we have ridiculously high suicide rates and attempted suicide rates and things like that. So even with the county, running the mental health clinic, we still have this
Can't do it alone.
symptom of COVID. We can't do it alone. And so those partnerships are really important. And the partnership with the hospital is one of the key players with the inpatient. It's really important too. So I don't really have any question or anything. I just want to make that comment. But
One thing I might add, just as a
Sure.
matter of law, when you receive state funding, you have to have a PCS. It's mandated by statute. That also has to be a full-time position.
Yeah.
Unless you get special permission to, there are some counties that have joined together at a PCS that serves multiple counties at the same time. You need to go through a lot of hoops in order to get the state permission. Otherwise, you have to have a full-time PCS.
And counties that don't run a mental health clinic still have a mental health budget and they still have obligations of services they have to
They
meet, right?
have to oversee the
Yeah.
implementation of the community plan developed by the Community Services Board. That's their function.
Yeah. Yeah.
And that's there regardless whether you do it privately or publicly or some combination thereof. You have to have a PCS.
Christine? Well, stay tuned.
more to come.
What I was thinking, Christine, is maybe we could group together 4, 5, 7, 8, 9, because those all appear to be contract renewals.
Correct.
So if you wanna kind of go over 4, 5, 7, 8, 9, and then I'll ask for a motion for them all and a second, and then we can discuss any questions, and then we'll just finish up with HH6. Okay?
Okay, so HH4 is asking to accept $25,000 in funding from the state OTDA to enter into a contract with TAP to provide non-residential domestic violence emergency services. So this is something that has happened year after year. Very, very good service to help folks that are already involved in the domestic violence services at CAP. The emergency, these funds can help with emergencies like car repairs, gas cards, moving expenses, lawyers' fees, and some concrete needs like clothing, bedding, things like that. HH5 is for us to enter into a contract with Booker T. Washington Community Center. So this is for summer camp sessions, and it's actually something that we have done each year as well. This is a little bit less funding than we have done in the past. Last year, we dropped our funding from $15,000 to $7,500, and we're asking for $7,500 again this year. The reason for the decrease is because their summer camp is much abbreviated because of COVID. HH7 is for a contract with CAP for the rapid rehousing case management services. This is a renewal of a contract that we've had that's very helpful in helping families that we're working with that are homeless, receiving services through the department, try to obtain housing, try to help them apply for subsidized housing, try to get them into something that's a permanent resource for them for housing. HH8 is, well, actually HH8 is for us to hire the 4 clerk seasonal positions here that work in the Department of Social Services. We're kind of ramping up for our HEAP season. Unbelievably, it's already coming up in a couple of months. So we're looking to get permission to hire those 4 clerks that we have that work with us. And then related to that is HH9. This is for the contract that we have with CAP for the outreach services that we are mandated to provide for the HEAP season.
Can I get a motion for 4, 5, 7, 8, 9?
Nightingale, I motion that we bundle 4, 5, 7, 8, 9 of human services.
Second? Okay. Any questions?
Sorry. I mean, the price of gasoline is up. I feel that the electric is gonna be going up. The good news is that, you know, the stimulus money that the state got will help their finances, so hopefully it'll help ours with delivering some of the services that our people need, so. But they are gonna go up.
We get a federal, this is a federal HEAP allocation that comes in to help support HEAP eligible families that live here.
Yes.
Okay. Great. Any other questions about those? Okay, all in favor?
Aye.
Anyone opposed? Great. Okay, Christine, HH6, best of my knowledge, is you're adding some funds to our current contracts that are currently existing to expand them in some way using budget money you have available, is that?
Yes.
Okay, so
So this is, we're asking to expand really a contract that we have with Cayuga centers for family preservation services, enhanced foster care support services, and restorative case management. And the reason that we're asking to do this is kind of in line with what Kathleen said. We're seeing an uptick in referrals. We are seeing an increase in families that are really struggling with managing some of their own issues and their children's behavioral issues. And we have some wait lists that we haven't seen in a while. In particular, you know, we're waiting to get family preservation in with families that are struggling and working with child protective services and preventive services. Enhanced foster care support is really about supporting the foster parents that are taking care of the children that are in foster care. And that was a contract that is kind of new to us over the last couple of years and has proved to be really successful in helping support the foster parents that are sometimes new to us, sometimes veterans, but are struggling with the behaviors of the children and are, you know, looking for some education and some, you know, just ideas and some support to try to help them manage these kids. And so we're asking for a whole other worker to do that with, you know, for a new caseload for them. And then restorative case management is for the youth that are a little bit older, you know, teenage, 10 to probably 15, I would say. Case management support for the families that are in the community.
Make a motion, we
Okay,
do whatever we can for our children that are in distress.
Thank you.
second? Great. Any questions about HH6?
I was just curious, do you have, you may not have off the top of your head, but do you have numbers of like how many families are in these programs?
How many are in each
Yeah.
of the caseloads?
Yeah, what the caseloads are.
Family preservation, they have a little caseload because they work so intensively with the families that they have. So I believe that they have, you know, a caseload of a few families at a time. So through the month, I would think that they would probably work with maybe 4 families that are kind of staggered. Some are entering into the program and some are exiting. So the intensity of the level of the case work with each family kind of varies depending on the point that they are in that intervention. Family preservation works with a family for about 4 to 6 weeks.
High risk of coming into foster.
Yeah,
Or
they're-
having CPS removed, I mean.
Correct,
Risky
they're our
families.
most intensive services that we have that are home-based. So they can spend, 20 hours a week with the family if need be. So multiple, they can check in every day, they have, if they need to, daily in-person interaction. The enhanced foster care support, I honestly cannot tell you exactly what that caseload looks like, but I would, my best guess would be that they're working with probably like 7, 8 families. And then restorative case management, I believe that their caseload is around 20.
That these funds potentially would give Cayuga centers the ability to hire additional staff to take on more work.
Right, so if we are able to enter into this contract, it would be 1 worker for each one of those programs. So 1 family preservation worker, 1 restorative youth case manager, and 1 more worker that would do the enhanced foster care support. And the enhanced foster care support services and the restorative case management are therapists, the family preservation services and the enhanced foster care support are therapists.
It just, average cost of handling 1 child for the year is what, 60, 80,000? It's expensive.
In what capacity?
With Cayuga Home,
In-
their special needs. When a child goes in, I mean, it's not a real inexpensive fix.
No, you're talking about for the preventive services?
Yeah,
For family? Oh gosh, that's hard to estimate. Family preservation per family is pretty expensive, because, you're talking about a family that has essentially a worker for part of the month. So I don't know if that cost is,
It's all about
Much
stabilizing.
lower
the-
than placement.
oh yes, it's much lower cost than placement. If a child had to be placed in a, residential placement,
Yeah.
that's, you're talking about
that's a residential is one.
much more.
So this is preventative.
This is
Yes.
preventive, right, these are still, these are families, except for the enhanced foster care support, that those are children that are already in the county's custody. We're trying to keep them at the foster care level, which is the lowest level of care in foster care, not in the therapeutic and not in the residential. So to keep them at this foster home,
Yeah.
our certified boarding home level of care, we think that giving them this enhanced level of support, a therapist to speak to, home visits, they're helping to connect them to other services, is helping to keep the children
In the same foster home too, without having to move kids multiple times, because the family says, I can't do this anymore.
If the foster families feel comfortable with the services that are being provided and they feel supported, they stick with us longer for that child, and they stick with us longer as foster parents because they feel like we have their back, they have what they need. The worst thing that we have heard from them is to feel like they're out there sort of floundering and not knowing, where to go for help or what to do. And unfortunately, what happens in those cases is they call us up and say, I'm done, I can't do this anymore. And then like Elaine said, we have to find a new home for that child, and that's, traumatic for the child and not in the best interest of anyone.
Anything for the kids.
All in favor? Okay, great. Thank you, Christine. Lastly is HH10, for the Mental Health Center, authorizing the filling of a vacant account clerk typist position due to a resignation. Like to get a motion for that?
Yeah, I'll move it.
All in favor?
Aye.
Any opposed? Great. That's a wrap.
Motion for
Adjourn?
adjournment.
All right,
Second.
Second.
all right. Thank you very much.
Please, you ready?
Yes, please go in.